now. So I tell you what we're going to do, though. Before I introduce Dr. Prasad, I found a little clip. There's all kinds of stuff out there on the internet, but this little clip is only about 2 minutes long, but it gives a little snapshot of what this RSV is and why it's such a major concern. So Nick's going to go ahead and cue that for us, and let's see if it plays.
Rates of RSV, or respiratory syncytial virus, have been surging since August. That's weeks earlier than the typical season.
Pediatric hospitals are pretty stretched right now.
So doctors are warning of a possible
triple-demic. That means cases of COVID, flu, and RSV, a virus that's been impacting children, are all expected to rise.
Here's what to know about the surge in RSV and what it means for your winter. RSV is a virus spread through droplets from coughing and sneezing and on surfaces. It's so common that nearly all children come in contact with the virus by the age of 2. And while RSV feels like a cold for most people, it can be severe for some infants and older adults. According to the CDC, about 58,000 children under 5 are hospitalized due to RSV every year. In pre-COVID times, hospitalizations looked like this, peaking in January. But in the first year of the pandemic, RSV rates flattened. That's because COVID safety measures like distancing and face masks also likely protected people from other diseases. But around the summer of 2021, cases of RSV shot up.
Once you sort of start mingling again and dropping those restrictions, you get a lot of cases happening at once.
There's no approved vaccine for RSV, and children who didn't get sick from the virus in 2020 or 2021 might have less immunity protection. And for this fall surge,
there's a couple things at play here. One of them sort of being that a lot of kids have gone back to school in the fall. And this year there was significantly less masking in a lot of schools and other safety precautions that there were for the past 2 years. There's been less exposure. Some of the tiniest kids haven't seen RSV before. And so you have sort of a higher susceptible population among sort of the youngest.
This surge in RSV comes at a time when other respiratory illnesses, like the rhinovirus and enteroviruses, have increased hospitalizations in children. So doctors are bracing for more cases.
The Connecticut Children's Medical Center in Hartford is considering setting up a field hospital in case things get worse.
And some physicians are worried about precautionary measures for high-risk infants.
Vulnerable babies, as a precaution, get injections of this monoclonal antibody during the normal respiratory season. But if, RSV strikes earlier or during the summer, a lot of those babies, unless hospitals sort of can anticipate and keep up quickly, sort of lose that extra protection.
It's not just RSV. The flu season arrived earlier than usual this year, too.
There is a lack of exposure because less people have had it for the past 2 seasons. Lower vaccination rates because, that's a sort of a better way to build up exposure. Less precautions as people are heading inside and into schools and workplaces again.
And that, combined with a possible uptick in COVID cases, has doctors worried about a triple threat of RSV, COVID, and flu.
A confluence of all of these viruses could put hospitals under serious strain this winter because for the last 2 winters, hospitals were completely slammed entirely just with COVID. What we saw during the pandemic is that if a hospital is overrun, it's harder to get in for any other sort of care that you might need. An overwhelmed hospital isn't good for anybody.
To help reduce hospital capacity, health officials are encouraging people to get their flu and COVID vaccines.
Well, that really kind of lays the foundation for this discussion because they're saying now in some states, hospitals are showing 90% occupancy, pediatric hospitals. So it's a major point of concern, hence our subject. Are you concerned about RSVP? And support the immune system, focus in on the immune system because we believe that the immune system can make a difference. But my opinion, in my opinion, is not nearly as significant as someone who really is in the know, like Dr. Kedar Prasad. So we're going to introduce Dr. Prasad here, but he has to be introduced properly. First of all, the FDA has not evaluated any of the comments that are being made. None of this. What you're about to hear is not intended to be a substitute for a visit to your primary health care physician. We strongly recommend that you seek the competent medical advice of a professional that you trust. Dr. Prasad is not a medical doctor. I'm Jonathan Jones. I'm not a doctor at all. I'm just a researcher. I don't recommend that you do anything that I say because I say it. We strongly recommend that you go to your primary healthcare physician. You may hear some testimonials today. Testimonials are purely anecdotal. What happens to one person may or may not happen to you. Engage Global does not make any claims that any of its products are a treatment, cure for any disease state. Only the government can declare something to be a treatment or a cure. But that having been said, it's my pleasure to introduce to you Dr. Kedar Prasad. Dr. Prasad was a professor of medicine at the University of Colorado School of Medicine. So he's got some serious time behind him teaching teachers, professionals at the highest level. Former president of the International Society of Cancer and Nutrition, member of the British Society of Medicine. Dr. Prasad was invited to be a Nobel Prize nominating committee on the Nobel Prize nominating committee for candidates in medicine. He was the world's first radiation biology PhD. His products have been awarded 7 US patents on micronutrients with a number of patents pending. Dr. Prasad is also the scientist who's credited with discovering the anti-cancer potency of vitamin E succinate. He also discovered that butyric acid, small fatty acid formed by fermentation of fibers in the gut, is an anti-cancer agent. He knows a little something about the gut. Dr. Prasad has also been published some 250 times in peer review publications. But in addition to that, at the ripe young age of 88, he's also authored his 32nd book. Now, what you're looking at here is just some of the books that he's put his name on and put pen to paper. And it just kind of reveals the level of brilliance that this man has. And this is his most recent book, the one there on the left, Dementia, Memory Loss, How to Prevent and Improve Treatment. It's an educational book and it's written for the public. The consumer can benefit from this. So it provides easy to follow guidelines on how to avoid the risk of memory loss. This book also provides recent scientific information on how to reduce the risk of memory loss and how to improve current drug treatment with the help of micronutrients. So as you can see, you see the prices is all available on Amazon. If you just take a screenshot here or just do a screenshot of that, the QR code, it'll take you right to it. Highly recommend it. I have a copy of it. I have several of his books. I don't have them all yet, but I'm working on it. And I absolutely love what this man is able to do. He's forgotten more than most of us know. So, folks, it's my pleasure, my privilege to introduce to you and invite to the spotlight Dr. Kedar Prasad. And this is the subject that we're going to be discussing with Dr. Prasad today. Dr. Prasad, once again, sir, thank you very much for being willing to join us. We appreciate it.
Thank you, Jonathan, for giving me this opportunity about the respiratory viruses, RSV,
Yes,
cause
indeed.
remedies, what causes it, and what we can do to prevent it and treat it better.
I found that little clip there from the Wall Street Journal to try to introduce it and to give me a little bit more information. Your presentation is absolutely phenomenal. So we're looking forward to this. So this respiratory syncytial virus,
Yes.
I'd never heard of it before this time period, this year. I did not hear about it. I didn't know it was a thing, until it became a thing. So we're looking forward to whatever you have to say to share with us here. Yeah,
this is the picture of this virus. You can see it is totally different than COVID-19. And people who try to develop a vaccine, they focus on 2 proteins. One is called fusion protein, and another is a G protein, which is also called attachment protein. So these 2 proteins are the major target for developing a vaccine or a specific target for our immune system to produce antibody. But I will tell you that this virus is so smart, unlike the COVID-19, that when I will discuss in detail, but just to make a statement that when he enters the cell, it is so smart that it produces cytokines which turn off interferon, gamma interferon, which is the natural antiviral agent produced by our body.
You have got to be kidding.
Yes, it's turned off. And one way is, as you know, that is the only way that you can increase the amount of interferon produced in your body against virus, any kind of virus, is the vitamin C. And it has been known for a long time that this is a natural way of improving your antibody. One thing. Second thing, this virus protein, he changes in a way, this fusion protein that you saw, which is the most likely, and G protein is not listed here very well. But yeah, attachment protein, here it is attachment protein. You see the red one is called attachment protein. That is also called G protein.
Yeah, that's
and
right here.
So this especially G protein, they change the structure in a way that it fools our immune system that they can't produce effective antibody. And that's why you have reinfection and again, because generally, like COVID-19 or other things, you develop your antibody because lymphocyte can store memory. Oh, I've seen this virus before. So they take care of producing antibody. But this virus is so smart that they fool our immune system, at least part of the immune system, which is called a adaptive immunity that produces lymphocyte, which then restores memory that I have seen this virus and I can produce antibody. But since this virus fools the system that they can't recognize it again, so you have reinfection again and again and again all your life. Okay.
Oh my goodness.
Second, yeah. That's you know, in a nature, this is very interesting.
That's mind-boggling, Dr. Prasad.
It
So
is.
we would normally think that if our body has seen this before, that
Yes.
the immune system just wake up and just do its thing, but it doesn't. So it has to learn every single time, again and again and again.
Yes, because so that they don't produce it. Only time these viruses are, when infants are born, they have a mother's antibody there. So for a few months, they can fight effectively. But this virus, even motherly, which has a virus, they decreases very rapidly, and then they becomes naked for this virus to come again. And so, but this is interesting. That's unique of this virus, that our body, our immune system, not only cannot produce effective, but to some amount, but cannot produce enough antibody, but also it cannot store the memory that I have seen this virus before. So that's why it is very difficult, has been difficult to develop a vaccine, because, but now they are doing some other kind of manipulation so that they can be better. But thus far, there is no vaccine for this particular virus, effective.
Wow.
Okay.
So no vaccine.
No. So there are three major glycoprotein, this virus that you can see the structure. One is called G protein, which is the attachment protein. This protein will attach to the cell surface of lung cells, for example. And then the G protein helps virus to attach to the surface of the, say, lung cell in your lung. And F protein is a fusion protein, and this helps the virus to fuse with the host membrane and then enter into the cell. And another thing very characteristic that other viruses don't have is that when the cell gets infected in your lung cell, then they attach, the infected cell attached to uninfected cell. And then they get infected like that. So rather directly virus, they infect each, and then the other one will infect. And so it becomes like, if you see the microscope, it becomes like a bundle of cells all attached together.
Oh, wow.
And that's why it is called syncytial, means fusion. Latin word is fusion. So this is one of the characteristics of this virus, that infected virus will infect uninfected cell, and then that will infect another an infected cell. So they form like a colony.
Oh my goodness. So instead of entering into your cells and multiplying, it turns every cell into a clone of itself almost.
Yeah, right. They keep attaching it. So the virus,
that's not good.
have to work that hard.
That's not good.
No. And that's why that's why this word syncytial virus comes from, because once you look in the microscope, you see a bunch of 50 cells hanging together,
Gotcha.
like forming a
Gotcha.
fused cell. Syncytial means Latin word is fused.
Fused. I got you. Okay, very good.
Now, this is the behavior of infected cell and the role of G and F. Now, G is attachment protein, F is a fusion protein in developing antibody. This RSV infected lung cell attached to several uninfected lung cells that gives appearance of syncytial. Both G and F protein, means attachment and fusion protein, are target for developing antibody. Antibody producing lymphocytes do not respond effectively and do not retain the memory of infection, causing repeated infection throughout the life.
That's horrible.
That's interesting that this virus is so weird type of virus.
That is just horrible.
Yeah. Now the question is where it came from. In the beginning, in 1956, a new virus was first isolated. This virus, RSV virus, for the first time, isolated from a laboratory chimpanzee that they were doing for some other experiment. And these chimpanzee started having the upper respiratory disease, lung disease. So the virus was isolated, and they started calling a chimpanzee RSV virus because they thought this is origin is chimpanzee. Later, the same virus was found when some children were hospitalized with the lung infection, and when they isolated the virus, it was exactly the same virus that the chimpanzee had. So it is not of chimpanzee origin, and therefore we can say that this virus has been with human for all these years directly, and so during the entire evolution period, this virus was present in human.
Wow, looks like the little kid that
and
wants to beat up
the reason it survived because it is infected.
Uh-huh.
Mother gets it infected too,
and she just passes it on.
It passes to the, so it has been there for a long time.
This little kid looks like he wants to beat that monkey up, or is it the virus he wants to beat up?
Yeah, I mean, first they thought, it was a chimpanzee origin, but no. When the sick baby who have never seen a chimpanzee went to the hospital and isolated the virus, it was exactly the same virus.
It was the exact same virus. That's amazing.
Yeah.
Absolutely amazing. Okay, where's this next slide? There we go.
Yeah. Now, now the question is how these viruses transmitted from one individual to another. Now, according to CDC guideline that Jonathan may have came across with, that this is a highly, highly contagious virus. And if somebody have infected person, and if they sneeze or cough, you can get it. Like you saw in the picture that Jonathan was showing, especially kids who are sitting against each other, you can pass through very easily. That's why the kids get affected. A virus droplet from the sneeze or cough can enter either through your eyes or through your mouth and can infect you. Direct contact, suppose if you have a baby and baby has this disease, which is more frequently, an adult kisses it, baby without knowing it, he can get the virus. And direct contact also with the surface, like tabletop, knob, open the door. If somebody has infected person has touched something and you went on touching it, then you can get infected. So it is very easy to infect it. What is the survival of time of viruses? At room temperature, non-porous substances like countertop or anything that is solid, they can live up to 3 to 30 hours for a long time. But if it is a porous surface like your clothes or tissue paper, they survive less than 1 hour. If it is in your hand or in your body and you touch somebody, and after 1 hour, then you are okay, but it survives in your body, outside the body for less than 1 hour. So the longest survival time is the surface, solid surface, like tablecloth, bathroom doorknob, any place.
Up to 30 hours.
Yeah. Could have stayed there. This is very long at room temperature. So this is that's why it is so contagious, because it is so much quickly you can get infected, and that these things are very easily transmission.
So that's the reason why it wasn't so common over the past 2 years, is because everybody was sanitizing everything. Everybody was wearing a mask.
Even the solid surface, the tablecloth or something, whatever you're doing it. Even I used to see that even restaurant people will clean up your table with sanitation.
Constant. Yeah, it was a constant cleaning.
Yeah. Now, what are the risk factors for who are at highest risk? This is very interesting. Premature infant. Sometimes babies are born before 9 months. They are very at high risk for this particular virus. Infant who are younger than 6 months, they are very vulnerable to these viruses. And of course, children with suppressed immunity, that's what we will discuss, because there are many ways you can avoid it, but in some way you can't. And like you don't know who came in my room, not in my room, but someplace you go in restaurant, someplace you don't know.
Right.
But infection. So some of those things you can't control. But the immunity of children or adult, that is in your hand. That you can do, improve it. High risk group is adult 65 years and older. They are all much higher at risk than younger people. And of course, even the older people who have a poor immune system, or he has a chronic lung disease, they are more susceptible to this virus.
Okay, so the immune system really is a key. So the weaker the immune system is,
both for
risk.
the children, both for the infant, the children, all people, or older people. Yeah, they didn't give here, but even the younger people, less than 65 years of age, they could be at risk.
They're at risk
older
also.
people 60 and 5 are higher risk, but that doesn't mean that if you are under that you don't have a risk factor at all.
Right. Gotcha.
And so immune system always, throughout the evolution, immune system plays a significant role for where we are today, for evolution. Otherwise, you'd have been extinct. Now here the incident time of, what is the timing of peak incidence of this virus? I think it is a late fall, which is right now, winter, and the earliest spring. These 3 times are generally, it is also flu season, coincide with the flu season. But in this case, they are at peak, and maybe because they survive better in this kind of temperature.
That's why they're talking about the possibility of this triple-demic they're referring to it as.
Yeah.
COVID, flu, and
also
RSV.
That, COVID-19 and its variant is always there. So now you have a RSV virus, then you have a regular flu virus. Then you have a top of these things. So that's why it is so vital. I can't emphasize enough to have your immune system in a good shape. And in that scenario, even though if you get one of these viruses, you will suffer less. So, in 2019, according to CDC, 6.6 million less than 6 years of age had RSV infection. And 1.4 million were hospitalized. And sometimes these hospitalized patients also end up in an ICU. Just like COVID-19, they have to give oxygen, ventilator, and things like that. So it is and then another interesting thing is.
But it has been happening, is what you're saying, Dr. Prasad. It has been happening. So even though it's raging out of control right now, it's worse now than it was in 2019, but it has been happening.
Yeah. And it is very interesting that children's, because most of the cases is confined to the children, but some adults suffer too, like I mentioned, older people. And so you can call it is primarily a children's disease, really. In fact, more infection with children. But beside that, children from lower socioeconomic background have a higher rate of infection and higher rate of hospitalization, including admission to ICU. You see, this is very interesting. Not only these children with low social background, but also Black American have a higher risk. Well, I think, I don't know, but so you can see that these people have no screening. They don't go to the hospital right away, so ended up in hospital. Once you get some cold, it is just cold, don't worry. Until you become serious, then you go to the hospital.
Right.
And so, and if you don't have insurance, if you have poor people, then they don't have this screening mechanism that you go regular hospital for checkup, and then if somebody detects something, you get immediate intervention. And so, for most of the middle class people goes there, they have every year checkup or dental, all kind of annual checkup and dental checkup. But poor people don't have that privilege.
Would diet have anything to do with?
Of course, diet. Poor people also can't afford a good diet, and if you don't have a good diet, you can't have immune system. Good immune system.
Yeah, more likely to be immunocompromised.
Yeah, exactly. Even the the middle class people, if they have poor diet, their children will be as bad. But in general, it is if you are poor people, then you have a less chance of getting a good diet.
Right.
And therefore, good immune system.
Everything traces back to
this is a societal issue. You cannot control it as a whole society. But what you can control is individual basis.
That's right. That's right.
Afford it.
You can make a choice. You can make a choice.
You can make a choice because sometimes, you can get a good fruits and vegetables, but you can get a simple micronutrient, which provide you all the things that good diet will provide. So at least you can do that much. I always say that to improve your immune system, you also have good diet with enriched micronutrient like fruits and vegetables, and take a scientifically prepared micronutrient formulation. And this is things that it is in your hand.
Yep.
Avoid contact with children or adults who show symptoms of coughing and sneezing. Sometimes it is difficult to avoid it because if you go to the class and your fellow has a ST, you are not going to sit down in a corner. So many things like socioeconomic things or you can't avoid it. It is not in your contact. If it is a genetic factor, you can't do anything. But one thing it is in your hand is a good diet is good idea, but is always not good in practice because they don't have resources. Even people who have resources, they don't do that. And so the easy way to do is that to take a micronutrient supplement and try to do all these things as much as you can.
Right. Yeah,
but
that's a good suggestion.
Have coughing and sneezing, parents don't say you don't go to school. They go to school.
No, kids are.
Don't say you don't come because these are all routine and they recover.
Yeah, and the kids are going to be kids, and they're going to be exposed to each other. Nothing is going to stop them from interacting with each other.
And how to improve once you have it? Like I said, first is follow doctor advice because it's a treatment issue, and then provide micronutrient and good diet. And the reason is because in that way, like COVID-19, when they enter the cell and they all form the fuse with other cell, they generate a lot of cytokines. And a lot of cytokine will damage a lot of cells.
Yeah.
And therefore, a micronutrient will decrease the production of these cytokines and therefore protect your organ from these kind of chemicals.
I used to think of cytokines as being the good guys, but boy, if they don't, if you don't answer
there are some cytokines, if you have acute problem, then they send anti-inflammatory cytokines, then they are good. But pro-inflammatory cytokines like IL-6, tumor necrosis factor, they are bad
These are the bad guys.
Yeah. Concluding remarks on prevention and improved treatment. Like I said, avoid the risk factor of infection. However, some factor such as age, genetic disease, or awareness of infected person or places are beyond our control. We don't know.
Mm-hmm.
Good diet and micronutrient supplement is in our control, that we can use it.
Mm-hmm.
In addition to doctor recommended, good diet and micronutrient supplement can improve the clinical outcomes and enhance the recovery rate of your body. And therefore, I would say in conclusion that even though this is deep, but many people don't know this phenomena, and they wait till they get sick, then they go to the hospital.
Yep.
And so how you make these people aware of all these things available, I don't know. I mean, Jonathan, you are doing a good job in making people aware of that what they can do. They just can't wait till this kid goes to the hospital.
No.
And then so I think there's a lot of things to do, but sometimes it is difficult to convince people.
Absolutely. Very difficult to do so. In fact, just to share one little personal story on this, I sent some of a micronutrient to my sister. My sister's daughter, her granddaughter, little girl, cutest little thing. She's about 6 years old now, I think. But anyway, I've always been sending her things to make sure that she kept her immune system nice and strong. My sister's doctor recommended for my sister that she not get any vaccine at this time because my sister is severely immunocompromised. So she recommended against it. Her husband got vaccinated against COVID. And but my sister was taking micronutrients, just like you were recommending here. And my little grandniece was taking micronutrients, just like you recommended here. My brother-in-law, love him to death, got sick as a COVID dog. And but neither my sister nor my grandniece, and they were coughing, sneezing all over him, doing everything in the whole house. Everybody in the house was sick, except my sister and my grandniece. So
See?
Your formula made all the difference, sir. So that's why I strongly recommend it.
Yeah, I mean, fortunately, we have a kid formula, and this is in a way, this is a kid's disease, really, mostly.
Yeah.
And adults suffer too, but I think it is we can do a lot for the kids so that they don't have to go, and not only that, you don't infect your fellow friends, And good news is that in most cases they recover, but they carry some other kind of residual disease which can appear in a long time when they are older. And
That's right.
So it is better to prevent it right now.
Absolutely. Fully in agreement with you. So we're going to get back to you in just a second here, Dr. Prasad, because I think some folks are going to have some questions in just a moment. But I'd like to just share some information now with everyone, because this is the mindset of most people, because there's a bunch of folks sitting here right now, even before I made that statement about my grandniece, that are wondering, is there a formula with real nutrients and that was especially designed for children? Does such a thing exist? Well, just so happens there is one. In fact, this is what it looks like right here, folks. So you can get a bottle just like this. You can just talk to the person who invited you here, and they can direct you to this this particular formula. It was especially designed for children, and it was Dr. Prasad who formulated this. He made sure. Now, my little granny, she happens to not like it, but most kids love these gummies. I mean, they love them. She eats them because she knows that I was the one that told her to take it. But these are just some of the benefits of this children's gummy. Healthy bone and organ development, mental clarity and mood stability, boost the immune system, DNA integrity and health. Dr. Prasad, could you tell us a little bit about this DNA integrity and health?
Yeah, it is, because we tested in an adult, and I'm sure that if it is true there, I'm sure it will be true for everybody that remember I told you that in a European collaboration with our vitamin was CT scan, and CT scan gives very tiny amount of radiation, and doctor never thought that there's anything think about it, so small. But then they decided, we convinced them to try to see if there's any damage. And what they did, they gave just only one CT scan. And then after the scan, they took out the blood and measured the DNA damage in the lymphocytes. And there was a immunostaining, so that if you stain these cells, then damaged cell will be stained and they can count how many cells are damaged. And so they said, yeah, they were surprised to see that one CT scan caused DNA damage, and one type of DNA damage called double strand break, because as you know, DNA has a double strand, and to have to again repair itself, you will require the help of DNA polymerase, which is the enzyme which is repair it. And so then they gave a microdaily, just the antioxidant part of the microdaily, because for this short experiment, they did not do all vitamin, because this was just a one-dose phenomena, and just see what happens. And so they gave, just before CT scan, gave this microdaily antioxidant mixture, and then measure it, and did the same experiment in lymphocyte, stained the cell, which has a DNA break, and they saw over 50% of them was decreased.
Unbelievable.
DNA repair system was working, but they did not take into account is that some of the free radicals that the CT scan generated, they also are long-lived. They live for 4 or 5 hours. So you just give only one dose and don't give another dose after radiation, then you should have done another dose and then done it, you would have a better results. But even with one dose, you can see that you have a tremendous amount of reduction. That means DNA repair system is working. And if you don't repair the DNA double strand, that increases the risk of cancer later on.
Yeah, cancer is in the pipeline. So thank you. That's exactly what I think everybody needed to hear right now. So listen carefully, folks. You see that's bullet point number 4 on this list is DNA integrity and health. And look at the very next line, EMF, radiation, and 5G defense. Now, the World Health Organization right now indicates that leukemia is no longer the #1 form of cancer in children. It is now glioblastoma. So what's the babysitter for children? So exposure to RSV, exposure to EMF, radiation, and 5G. And in this gummy, the scientific evidence exists that it's able to assist with DNA integrity and health. So Dr. Prasad just described the whole study, the way that they confirmed it.
And mention
this is what you want in your child.
Yeah, and mention there's glioblastoma. There's no treatment of glioblastoma right now. If you have glioblastoma, you will die within 18 months.
Oh my goodness.
Nobody survives.
Wow.
No matter what you do, treatment or no treatment. I mean, treatment maybe a couple of miserable, few months. And unfortunately, as you know, Jonathan, my son died of glioblastoma. We did everything possible. But so it is a deadly tumor. But then in brain,
prevention is better than the cure then, right?
Yeah, prevention, exactly. And if you know that these kind of things can cause some of the damage, why not try to prevent it as much as you can? But you can't get rid of EMF radiation. It is everywhere.
It's everywhere.
Second best thing is for kids as well as for adults to have this micronutrient that can help you.
That's absolutely the case. And that's the reason why we're trying to encourage this, folks. So right now, Engage Global has put out a Black Friday special. So just want to make sure everyone is aware of it. The special right now is you can get the children's gummy. You buy 2 of them and you get 1 free. So there's the Black Friday special. So the simple thing to do is just to get back with the person who invited you to this discussion, and they'll help you to get it. But for the rest of us, in case everyone's wondering, what about adults? This is the one that Dr. Prasad, this is the bundle that Dr. Prasad recommends. I think that this is the absolute best. I take everything here. My wife, my mother-in-law, my sister-in-laws are even starting to get on board. The cats are taking Micro Daily now. So everybody realizes there's benefits to taking Micro Daily. So the simple thing to do is just make sure that you get back with the person who invited you to this discussion, and they'll help you set up your own wholesale account for these products. So can we take a couple seconds now? Oh, by the way, before we wrap up, I want to let everybody know that next week I'm going to be interviewing Dr. Prasad about athletic performance.
Yeah.
So next week, Dr. Prasad is going to be giving us some detailed information about how micronutrients affect athletes on every level. So you can look forward to that at 5 o'clock on Sunday as well. So how about we take a couple of questions in, Dr. Prasad, because I'm sure that there's some now that are probably about to jump out of their skin and itching to ask a couple of questions here and there. Yvonne Jarrett is the first hand that went up.
Hi, Dr. Prasad, and hi, Jonathan.
Hi.
Well, I wanted to find out because I work in and
You work with what now?
I work in the school system,
Mhm.
and I noticed that I've had this cough, and I'm not sure if the RSV is recognizable in adults as RSV, because I went to the emergency room and they said that I had an upper respiratory problem, infection, but they could not tell me what it was because the test that they did not indicate whether it was RSV or whatever. So yeah, this cough is annoying, and I know all the kids are sick, runny nose, whatever the case might be. And I think we're so prone as being in the classroom to whatever that there is. And so I'm just wondering, is it recognizable in adults?
No, I think until you get a PCR test, they have general test may not be as effective as PCR. And so those doctor knows which is the most effective, but you can tell the difference between a general flu virus and RSV virus, because if you see under the microscope, the cell will be like a clump joining to each other. That is a very classical sign, very simple. You just take just a little bit blood and try to see the tissue, and then you will see that they have formed the colony type of things. But the surest thing that hospital knows is that they can distinguish very easily whether it is RSV or COVID-19 or So
I was tested
they give you bad information. But just looking at it, you can tell it because the symptoms are very similar.
Yeah.
And I think so. The one thing, even though if you have, say for example, virus, still you can take some micronutrient or good diet, and hopefully that your immune system can produce something that there's another kind of cell that immune system which is very effective in killing these viruses is the neutrophil macrophages. They go directly attack the virus, engulf them, and digest them and kill them.
Okay.
And so they remain active. But it is the other was not very active, is the lymphocyte or adaptive immunity. So they can't produce enough antibody, or they can restore the memory that I have seen this virus. So you get reinfection. So the important thing is, though, if your immune system is very good one, then it will prevent, at least to a great extent.
Yeah.
How much microdaily are you taking now, Yvonne?
Well, I ran out and I ordered last week. I still haven't gotten any, but I usually take like 2 in the mornings and 2 at night.
So let me see if I got this right.
Yeah.
You work in the school system around kids with runny, snotty noses all day long, and you ran out.
I know.
You ran out.
Well, something, I am thinking of my children, and I pack up because I usually order like 3 boxes. So I figured that I'm going to ship them a box so that they're they have stuff to stay healthy and not thinking of myself.
Yeah.
So I'm waiting for that. Hopefully I get it on Monday or something.
All right, Yvonne. Well, here's what you might want to consider doing. Now, Dr. Prasad may not tell you this, but what we've seen in the field is you might want to increase your dose. So instead of just going with the dose that's good for a healthy young adult, you might want to go with something for someone who's not quite so healthy. Just increase the amount a little bit, an extra capsule or two or an extra dose or two.
I do the EMF and the MMF.
Mm-hmm. Good.
And so
good.
Yeah. Okay.
Add more to each
collagen, and I do the collagen and all these brain boosts, everybody.
But see, 2 capsules twice a day is not going to be enough. Is that 2 capsules of EMF twice a day?
2 capsules, yes.
Of EMF. Okay, so that's not even the full dose. That's a pediatric dose. So you want to go to more like 4 capsules twice a day or 5. Okay.
I will. Thank you.
You're quite welcome. And thank you for that question.
Thanks, Jonathan.
Let's see. Anybody else had another question came up in the chat. Some Dr. Prasad were asking how to get the recording for this. Look on your screen and you can see YouTube right now. It's being live streamed. And you can see the little arrow, the little upside down triangle right beside YouTube. Click on that and it'll let you copy the link. And that link takes you to the recording. That's how you can get the recording and can share it with anybody that you like. So that's the easiest way to do it. Any other questions out there while we have Dr. Prasad? Okay. Wow.
Could you repeat the YouTube instructions?
Right there on the top of your screen toward the left, you see where it says live and then it says YouTube right next to it. Click on YouTube and it will give you the option to copy the link.
Mm-hmm.
Once you copy that link, you can paste it anywhere. Paste it into a browser and then the browser will open you right up to the recording. Okay? And Sharon Robinson has a question or comment.
I just want to ask a question. In reference to my grandchild, she's 12, but she's a big 12. She's like 5'10", and she's like 220 pounds. So would she take the EMF, or could she still take the gummy because she turned 12 in June?
How old is 12?
She's 12, but she's 220 pounds.
Oh, well, that's it is a genetic reason he is that heavy, or you think it is a dietary lifestyle issue?
She loves to eat.
Okay.
Mm-hmm.
Okay. And so I think, no, for him, I think it is so high. I would recommend a adult dose of the micro daily for him with methylated one, and he can take a 2 capsule in the morning and 2 in the evening. But a micro daily EMF for adult, I don't think I will go that far for 12 years old, even though he's heavy. And also try to convince his or her parent to watch out his weight.
Yeah, because she went down to like 195, and then being around other people, then she gained like 25
I think the
pounds.
easiest way cut would be to cut out the drink like Coke or Pepsi or some other drink, which are loaded with sugar. And you can have 1 a day, but sometimes those kids of that age take 2, 3, 4, 5 a day. That's even though you are not eating it, but just drinking alone, that kind of a level will increase your weight very rapidly.
Yeah.
And as you know very well, that increase in weight is associated with all kind of disease, including diabetes.
Yes, absolutely. Okay, thank you. I appreciate that.
Thank you. Very good. Very good. And let's see. I'm trying to do a screen share here because someone said that the price that was on the PowerPoint was not correct. And so I'm going to let's take a quick look here so everyone can see it. This is what came up on microdaily.com. However, I believe that once you put it on subscription, I don't know if you go on subscription that the price changes, but I'm going to go back
no, it's 134. I actually just ordered 10 minutes ago.
I'm going back one page just to show it, because on the page before it, it does say as low as 134. So I'm not sure why it showed 178 on that page, but if I click on it right here, it takes you straight to that same screen that says 178. So, but the price is actually 134, folks. So just so everybody is aware of it. So that price 134 is the correct price for the two. So maybe that was the original price, and they're going to show a discount of $65 or something at checkout is probably what it would do, or something like that. So yeah, good catch there. Thank you, Bernard. That's why we have co-hosts, so everybody can catch all the.
Thank you. Yeah. And I think, for children, it is right now, between now and winter and early spring, it is very, very important to have those gummy, because they are made on the same principle like Micro Daily, except the dosage of each ingredient is lower for the kids. That's the only difference, really.
Very good. Very good. James Peters has a question. He's been waving there for a hot minute or two. Bernard, did that take care of your issue?
Well, no, there was actually one question for Sonny Kroon. That's why I had my hand up.
Go ahead.
Sonny Kroon, this is not in regard to RSV. It's in regard to Sonny Kroon sent me a message that he's been on the product for 1 month, and he has his nerves in his legs, his feet is dying, and he's and he said he's in pain when he's walking. He's been on it 1 month, but he said, I guess neuropathy is a part of it. But anyway, he asked, can dead nerve cells be revived by taking Micro Daily? And what do you recommend when his feet is hurting very, very bad? He's been diagnosed, his nerves are dying in his lower extremities, and he wants the best chance of actually, and by the way, he says he's been taking it a month, but he's in extreme more pain, and it's this unusual.
Yeah, I don't know. Is he taking a Micro Daily EMF?
Yes, he's on there. He's got he's taking the Micro Daily, the original.
Yeah.
Should he switch to the EMS?
Okay, EMF is switching. And since he had this kind of serious issue of what is called peripheral neuropathy, could be related to diabetes. Does he have diabetes?
No, he's on there. He's Sonny Kroon. I don't think you know how to unmute, but he does not have diabetes.
He has a peripheral neuropathy. You can get also if you have a survivor of the cancer. They get a peripheral neuropathy. Means extremities, you get tingling, itching in nerves, and so I think that many people that they had this kind of problem will benefit, and I would suggest that if he's taking EMF, he can increase the dose at least for a few weeks to say 4 capsules in the morning and 4 in the evening, rather than 3 and 3, and also that watch out for sugar intake. And he will also, I would recommend probiotics. I don't think he's taking probiotics. And because probiotics is associated with all kind of problems that he's having and many other conditions. And so only thing I will change is that little increase the dose of Micro Daily for some times and take a probiotics. That is a must.
And the collagen he's taken, so he's about 82, 83. So it's a collagen, probiotic.
That's good.
And EMF.
That's good.
Correct.
So that's all you need. And
Okay,
properly, since he's that old, he need also a brain boost. But it's nothing to do with the peripheral neuropathy, because that is a central issue. But anyway, but sometimes resources becomes a limiting factor, and therefore I respect that. And so, but at least those 3 that Bernard you mentioned is a must for him. And sometimes this peripheral neuropathy does not happen in acute way. It is a chronic issue, and therefore it takes longer time to get some benefit. 90 days, if you take 90 days, and Bernard, let us know next meeting that you are on, and how he's doing it, because I like to know it.
Very good. Thank you, Dr. Prasad.
Thank you, Bernard. Good question. So Dr. Prasad, I'd love to take a few more questions here, but we have to stop now because we've got to transition to the next meeting.
Okay.
So for the benefit of everyone who's here right now, if you do have some more questions, just make sure that you just submit those questions to the person who invited you, or to Jeff, or to myself, and we'd be more than happy to run them by Dr. Prasad and get you an
Yes.
answer to them
Yes.
as quickly as
Definitely.
possible. So thank you very much again, sir, for the tremendous amount of insight that you provide and the knowledge that you give us that helps people, families, to navigate this morass of illness that exists all around us right now. So keep in mind, folks, that what you've heard today is for education and information and entertainment purposes only. We strongly recommend that you seek the competent medical advice of professionals that you trust. This is not intended to be a replacement or a substitute for a visit to your primary health care professional. Seek the competent medical advice of professionals that you trust. Testimonials are purely anecdotal. What happens to one person may or may not happen to you.